Hello and welcome to Nurse Intuition, Story of the Day. This is the unique bonus audio we provide to you for greater clinical clarity. My name is Shane Wall, and I am one of the founders of Nurse Intuition. During my first month as a nurse orientating in the ICU, I remember one of my colleagues receiving a 61-year-old male named Mr. K. He was diagnosed with congestive heart failure. In other words, he had large amounts of fluid on his lungs. The patient physician ordered aspirin, Lasix, atenolol, and Protonix to be administered to the patient as his routine medication. I will never forget what happens next. Mrs. A, the nurse, received a call from her child's school stating that the child was sick and someone needed to pick the child up as soon as possible. Mrs. A gave the remaining medication to Mr. K, then gave report to another nurse, then departed the hospital. Approximately 15 minutes later, a code blue was called in Mr. K's room. It was discovered that Miss A pulled a paralytic and administered that medication instead of the scheduled medication. At this point, I was literally in tears because Mr. K died. I was confused, I was upset, I was disappointed, and I questioned my profession. How can a person be so inconsiderate? How can they give medication that's not ordered? How can they give medication they are unaware of? What do we tell the family? What do we tell the physician? What do we tell administration? At that time, I thought of my family. I thought of my friends. I thought of other patients. Actually, I thought of myself. That could have been me. I highlight this story because it affected me as a new nurse, and it still does today. I share this with you so that you can take the mistakes of Miss A and understand that this profession isn't a game. It isn't just a job, but a profession that we're responsible to be competent and deliver quality care to patient in order to save their lives. Let's take a look at some of the key points that'll help you along your clinical journey. Number one, please understand that the purpose and the type of medication that you're administering. Number two, if you don't understand, please ask. Number three, utilize the pharmacy for any questions that you don't understand. Number four, make sure that you understand the rights of medication administration, such as right patient, right medication, right dose, right route, right time, right documentation, right reason, and right response. Never allow outside situations to affect how you're thinking in the hospital because you can make mistakes. As you know, Mr. K died from the adverse effect of the medication. In regards to Miss A, she was suspended initially, then fired, then she lost her nursing license, and then she was charged with manslaughter. I hope that this story will provide you the clinical intuition needed along your clinical journey. Until next time, thank you.